Alright, Shalom. Before we start, we'll give all praises, honor, and glory to Yahweh, Bahashem, Yahweh Shai, Bahashem, Bakah Kwadash. Double honors to the apostles and elders of Great Millstone who teach and rule well. Peace and salutations to the hopeful elect. Alright, today's lesson in the video is could this spark another epidemic? Alright. And what I'm talking about is over in China is if you haven't heard, there's a illness over there going on, and the hospitals are overfilled, and that's how the last pandemic started. It came from the Lord, of course, but it went, COVID started over in China. All right, and this this next one, the one over there, they have respiratory illnesses, and I got an article that I'm gonna pull up that we can read. All right. It says China says a surge in respiratory illnesses is caused by flu and other known pathogens. All right. So we're gonna read it. We're gonna read some of this. We're not gonna read all. I'll put the link in the description, Lord willing. All right. And then we'll probably watch a video to get more information, and then that'll be it. All right. So this came out November 26th. What's the day? It's the 28th. Yeah. Man, Salaki, I'm looking at something. All right, yeah. So it came out 2 days ago. So this it says a surge in respiratory illnesses across China that has drawn the attention of the World Health Organization. It's caused by the flu and other known pathogens, not by a novel virus. The country's health ministry said Sunday. Recent clusters of respiratory infections are caused by an overlap of common viruses such as the influenza virus, rhinoviruses, the respiratory syncytial virus, sorry if I'm saying that wrong, or RSV, the adenovirus, as well as bacteria such as mycoplasma, pneumonia, which is a common culprit for respiratory tract infections. A National Health Commission spokesperson said. The ministry called on local authorities to open more fever clinics and promote vaccinations among children and the elderly as the country grapples with a wave of respiratory illnesses in its first full winter since the removal of COVID-19 restrictions. All right. So that's what's going on. Let's see if we can get another one real quick. So, refresh that. Something recent. In fact, let's type in that respiratory disease. Now, this is 3 hours ago. This is in CNN. All right. It says, how concerning is the spike in respiratory illnesses in China? A doctor explains. So this came out today. It says hospitals in northern China and Beijing have reported a surge in the number of children with respiratory illnesses, including pneumonia. Last week, the World Health Organization asked China to provide more information on the cases. Based on what is known thus far, how concerning are these cases? Why might there be a surge in respiratory illnesses? Should people traveling to China rethink their plans? What additional precautions should governments, health systems, let me slow down. What additional precautions should governments, health systems, and individuals take to help? And I'm not gonna read all of this. We're going, just skim through it. All right. I'll put in the link in the description, Lord willing. It says, to help us understand the situation, I spoke with CNN wellness medical expert Dr. Lena Wen. Dr. Wen is an emergency physician and professor of health policy and management at the George Washington University Milken Institute School of Public Health. She previously served as Baltimore's health commissioner. Okay, so this is where I'm from. I guess she was here. I didn't know that. All right. It says, how concerning is the spike in respiratory illnesses being reported in China? Dr. Lena Wen, thus far, based on what we know from who was the World Health Organization, I don't think the spike in respiratory illnesses should cause global concern. What would be the most worrisome to the international medical community is if a new pathogen is emerging, as it did in the form of COVID-19 in the winter of 2019. This does not appear to be the case now. After WHO or WHO requested additional information from Chinese health authorities, it received data that indicates the increases in outpatient visits and hospital visits can be attributed to a rise in known existing pathogens. Specifically, there has been an increase in pneumonia due to the bacteria Mycoplasma pneumonia since May, and a rise in influenza, adenovirus, and respiratory syncytial virus (RSV) since October. The spikes are not unexpected given the lifting of COVID-19 restrictions, as similarly experienced in other countries. Salaki for the ad. According to the WHO, importantly, no new pathogen has been detected. There has also been no unusual clinic presentation, with children appearing much sicker than normal. All right, so that's what's going on. All right, so respiratory illness going on over there. They got hospitals filled up. All right, let's get a video, then we'll hit the scriptures. I don't want nothing too long. NBC News.
CW Courtside Saturday tips off this week at 12 Eastern.
What is Acorn, by the way? What is?
So Acorn is a financial tech company. So
And as we
All right. So it says China grappling with spike in respiratory illnesses. U.S. seeing rise in flu and RSV cases. No, I didn't know that. All right, so let's tune in and watch.
And as we head toward winter, we're seeing an alarming rise in respiratory illnesses like RSV in children. Ann Thompson now on what parents need to know.
These scenes of packed hospital waiting rooms raise an alarm in China as it grapples with a spike in respiratory illnesses, mostly in children. The World Health Organization is asking for more information. Here, flu is now spreading across the U.S., the CDC reporting a nearly 4% increase in flu-related doctor's visits. The Southeast hit especially hard, but not like last year's triple-dose. Grapples with a spike in respiratory illnesses, mostly in children. The World Health Organization is asking for more information. Here, flu is now spreading across the U.S., the CDC reporting a nearly 4% increase in flu-related doctor's visits.
Look at the South. That's bad, man. All right. So, this is going on in the U.S., I guess, in the South, mainly. Everybody else in the green, I guess, safe, different colors. But, this is making its way, man. So let's continue to watch. Slovakia for the.
The Southeast hit especially hard, but not like last year's triple-demic, flu, COVID, and RSV. Doctors say RSV cases are on the rise.
We've actually seen a tremendous increase in the number of children who we have diagnosed with RSV over the past 7 to 8 weeks. probably some of the highest that we've seen all season.
Dr. Shane thinks cases have peaked at her hospital. They're increasing among children at GBMC Healthcare in Maryland. But a new preventive antibody called Beyfortus is in short supply.
How many doses did you get and how many doses do you need?
I need a whole lot more than what I've gotten. I have received less than 50.
Dr. Teresa Wynn says it is crucial expectant moms get the RSV vaccine made for them.
Pregnant mothers between 32 to 36 weeks can get the vaccine, and if there's been 4 weeks, they have made antibodies and have passed it on to their infants at birth.
Though the CDC says 77,000 additional doses will be made available, it's advising doctors to prioritize those who need it, including infants 6 months and younger or with underlying conditions.
And Ann joins me here in the studio. Why is this antibody in such short supply right now?
Well, the manufacturer, Sanofi Pasteur, says that despite an aggressive supply plan, the demand for Beyfortus has been much higher than anticipated. In the meantime, doctors say it's also important for adults over the age of 60 to get the RSV vaccine to stop the spread and protect the most vulnerable and youngest among us, especially during the holidays, Lester.
All right. Ann, thank you. Thanks for watching. Stay updated about...
All right, so you heard it. All right, and you know, knowing Esau Edom. Well, first and foremost, this could be of the Lord. This is of the Lord, of course. We know that, but you know, he probably putting the spirit on Esau Edom to create something new. You know, knowing them devils. All right, so you heard it. All right, and like I said, this could be a new epidemic or pandemic. All right, it's made its way over here. You know, as we read, or as we watched. All right, China grappling with spike in respiratory illnesses. U.S. seeing rise in flu and RSV cases. All right, so this could be another virus on the way, man. And you know this in the scriptures. So let's go to Matthew 24. You know, we're just gonna hop straight into it. We'll start at 6. Ye shall hear of wars and rumors of wars. This is what Yahushua is telling his disciples. You know, the things that's going to come during the latter days. There were signs of his coming. All right. It says, and ye shall hear of wars and rumors of wars. See that ye be not troubled, for all these things must come to pass, but the end is not yet. For a nation shall rise against nation, and kingdom against kingdom. And there shall be famines and pestilences and earthquakes in divers places. All right. Let's look at that word pestilence or pestilences. Right. G3061.
Strong's G 3061. Loimas. Loimas.
Loimas. All right. It says pestilence, a pestilent fellow, pest, plague. All right. So it's a disease, literally the disease, or figuratively a pest, pestilence. All right. Let's go to Google, see what they say. Pestilence. All right.
Pestilence.
A fatal epidemic disease, especially beyond the bubonic plague. All right, so this is a disease, a plague. All right, a sickness, a pandemic, or you know, this could be a plandemic. All right, infection. Right. This is you know, this is what's coming. We're in the latter days, so we're going to see this. This is going to happen. All right, for nation shall rise against nation, and kingdom against kingdom, and there shall be famines and pestilences. All right, diseases, plague, pandemics, epidemics, and earthquakes in diverse places. Let's get a different translation. NLT, nation will go to war against nation, and kingdom against kingdom. There will be famines and earthquakes. I ain't like that. Doesn't give you everything. Let's see what the GNT says. Salakia. Matthew 24. 7. It says, countries will fight against countries. Salakia. Countries will fight each other. Kingdoms will attack one another. There will be famines and earthquakes everywhere, you know. And these not good translations. They don't, you know, because the KJV says pestilence. You know, you got to include that, man. All right. So You know, this is coming though. This is coming. Pestilence. All right, and everything else is gonna come right after. All right, let's go to let's read Second Esdras. Second Esdras 16, and I put what I put. I put 8. Salakia for that. This Second Esdras 16. I'm gonna start at 17. It says, woe is me, who will deliver me in those days." All right, this is the prophet Ezra. All right, and this is proving that reincarnation is real, but that's a topic for another day. It says, "The beginning of sorrows and great mournings, the beginning of famine and great death, the beginning of wars, and the power shall stand in fear, the beginning of evils. What shall I do when these evils come? Behold, famine and plague and tribulation and anguish are set as scourges for an amendment." All right, so what's that mean? The plague, disease, all right, epidemics. This is all coming, and they're set as scourges for an amendment. A scourge is like a punishment. An amendment is a correction. All right, they're sent as punishment for correction. If you read it in that way, right? Let's read in the GNT. See what we get. The Second Esdras 16 and 18, it says, I am doomed. Who will rescue me in those days? Troubles will come, and many people will groan. Famine will come, and many will die. Wars will come, and the world powers will tremble. Disasters will come, and everyone will be terrified. What will people do when these disasters come? Famine, epidemics, troubles, and suffering are sent to punish and correct people. All right. So these epidemics, they're coming, man. All right, they're prophesied about, and that's gonna happen. All right. I ain't want to make this too long, right? I just want to bring that out real quick. Second Esdras 15 and 5. So yeah, hold on. Salaki for that. All right. This is just 15 and 5. It says, "Behold, saith the Lord, I will bring plagues upon the world, the sword, famine, death, and destruction." All right. "For wickedness have exceedingly polluted the whole earth, and their hurtful works are fulfilled." All right. So the Lord is bringing plagues upon the earth. He's bringing diseases. All right. And of course, then he brings the sword, famine, death, and destruction. All right. Let me see if that says in GNT. It says, "The Lord says, I am going to bring terrible disasters on the world, war, famine, death, and destruction, because wickedness has spread everywhere, and evil has reached its limit." All right, so that means disasters, but you can still translate that to plagues, to diseases. Salakia. Let me see something. Yeah, that's it on that. All right, so Lord willing, I put that. That's what I want to bring out. Lord willing, I put this link in the description. All right, so this is what we're watching out for, man. All right, we're in these latter days, and epidemics are on the rise. There's gonna come. There's gonna be another one. All right, the first one was just a test run. I'll see how many people will take that jump shot. But this is really going to get people's attention, like Bill Gates said. All right, or I'm just say Bill Gates. All right, but really kill Gates, because he's a demon as well. He's a devil. All right, so Lord willing, this lesson was edifying. We gonna give all praise, honor, and glory to Yahweh, Bahashem, Yahweh Shai, Bahashem, Rakak Wadash. Double honors to the apostles and elders of Great Millstone who teach and rule well. Peace and salutations to the hopeful elect. Till next video, Lord willing, Shalom.